All of the hospitals within Novant Health are down to single digits in terms of inpatients with COVID, except Forsyth Medical Center. The census remains higher at Forsyth Medical Center than our other facilities, but only about 25% of the patients in the hospital at Forsyth Medical Center actually live in Forsyth County. Over half of these patients live in two surrounding counties combined, Stokes County and Davidson County. This shows we still have pockets of COVID in this region, particularly in areas that may be less inclined to get vaccinated. We still hear individuals say they're not going to get vaccinated because most people recover from COVID illness. We've even heard leaders in our community, our state, and our nation say this. Vaccination is an important part of protecting oneself, but it's also an important part of protecting your loved ones and your community. It's part of being a good citizen in a society that has a lot of vulnerable individuals who are getting older, like all of us, and a lot of individuals with immune system problems who may not respond well to the vaccine. I can tell you from personal experience that there are patients who have immune system problems or take medications that affect the immune system or have had an organ transplant who have gotten COVID vaccine, but they were not protected because their immune systems don't respond as well to the vaccine as maybe some others do. And then they've subsequently gotten COVID, and sometimes they've been hospitalized. That's why it's important for the rest of us to get vaccinated so we protect those people in our community. That's what being a community is all about, and that's what being a good citizen is all about. Because viruses and bacteria and germs cannot be seen with the naked eye, we do not often place responsibility on the spread of contagious disease to a vulnerable person, to another single individual. But think about what if we could do that? Think about how you would feel if you found out you were responsible for passing on COVID to an individual that ultimately led to them being hospitalized or they died, particularly if you could have been vaccinated and were not. So I think most people would be devastated by that. But because we don't have that ability to track very well, that can happen and people don't know it. We live in a fiercely independent culture, but this is a time to consider how our actions may impact the most vulnerable around us. And we certainly understand the need for individuals to make this decision to be vaccinated based on good information. And we also recognize there's a lot of bad information out there that makes the decision even more confusing. And as we mentioned before, I've found that one-on-one conversations with individuals to address their concerns goes a long way toward people having the information they need. And that's why we've moved vaccination into many of our provider clinics and continue to expand that over time. Novant Health has led the state in getting vaccines into physician offices because we believe that vital conversations happen there. And patients can get accurate information that they need to make a decision on vaccination in those places.